I injured my back lifting improperly about 6 years ago, and came to see Dr. Dreyer, and at the time it was just kind of a herniated disc in my lumbar, and I lived with that pain for about a year with pain meds and just trying to do ice and heat and with no relief. And then probably about a year later was walking down the steps of my house downstairs, and the pain just shot through my back and I was completely frozen. Couldn't move. My husband had to come upstairs and carry me downstairs. I lost all the feeling in my left leg. To get into bed, my children had to kind of lift my leg up to toss me over because I couldn't move. And so we went to see Dr. Dreyer again, and he told me then that I needed to have a discectomy, and so we scheduled that right away. So that was my first procedure, and that was 5 years ago. And he told me then that I was at a 70% chance of rupturing the disc again and would have to have a fusion at that point. And then after about 3 months, the pain was coming kind of back down my leg again. So I came back to see him in April of last year, and he told me then that the disc was just gone. So it was just bone on bone, crushing all the nerves, and that we need to go in and do a fusion. Kind of scary, you know, that thought, not knowing what that really would do to me in the long run. And so after visiting with him, he, you know, reassured me that that was my only option unless I wanted to live like that for the rest of my life, and it was just excruciating. So we did the fusion in April, and the recovery's been great, normal, I would say, you know, 2 weeks off of work, and I took pain pills for about 3 months, and I haven't been on them since, and my life is normal now. The pain that I had was from my abdomen where they went in. After about the 3-month mark, nothing. There's no pain. Back to normal life, back at the gym, picking up bags of dog food, you know, doing whatever I want to do now. My family's still very guarded for me, and, you know, watch out, but I've been released to do my normal life, and things are great. I would say don't hesitate to go ahead and do the procedure and get relief, because it's just, otherwise it is excruciating to live like that, and you can't do anything. You can't, I couldn't bend, I couldn't stand for very long, I couldn't, you know, take care of my family. And now that I've had the surgery done, I'm back to me, and it's, you know, I can take care of my household.
We're 9 months, right?
Yes.
How are you feeling?
Wonderful. Just wonderful.
Tell me what you were feeling like before the surgery.
Extreme pain would affect my day. Couldn't perform any activities after work. Just was horrible.
And was the pain in the back and the leg?
Yes.
And you tried everything before the surgery to get rid of it and nothing had helped?
Yeah, over-the-counter stuff and even some pain pills that I had left from, and it just nothing.
So how active are you now?
I'm back to normal life, back at the gym, doing what I want to do, going skiing, spring break, just normal.
What do you normally do when you're in the gym?
Do the treadmill, elliptical, some weights.
Mm-hmm. And how's your energy level?
It's back to normal. It's very, like nothing ever happened.
So you would rate your surgery a success?
Very much so.
Okay. And no leg pain, no back pain?
Mm-mm. No.
How long after the surgery did it take before you sort of turned the corner and really felt well?
It was probably about the 3-month mark that I didn't have any more pain. I was off pain pills and felt normal. Still restricted, you know, to the weightlifting, but felt like I could have, but I didn't.
And how soon after surgery did you go back to work?
Within 2 weeks.
Within 2 weeks. And you were driving in about 7 to 10 days, right?
Yes.
Okay. Well, let's take a look at your x-rays.
Okay.
I brought in a model so that I could show you what we're looking at. And let me put up another view. So we're, in this view, looking at your spine like this. And here is that polyether-ether ketone implant. Mm-hmm. And if you look at it from the top down, there's a hole in the center that we put the material in that would allow the bone to grow. And then in your case, we put 3 screws in, just like this model has, 1 going up and 2 going down. And then in addition to that, in this little groove right here, I put a little bit of extra material to form bone in the front.
Okay.
So this is looking at you from the front. You can see one screw going up, two screws going down, and the implant is sitting in the vertebra like that.
Okay.
Now this view is taken like this, and this is looking at the implant from the side. And again, one screw going up and two screws going down.
Okay.
And the nice thing about these x-rays is that we can see how much dense bone there is growing in here. You've got bone growing all through the implant, across the front of the implant, and even just behind the implant. And because the bone only grows where the carrier is for that, you only have bone right to there, nothing back into the neural canal. Now, we took x-rays with you bending forward and leaning back. And when you bend forward, there's no motion here, which means that you're solidly fused. And again, this is a perfect x-ray at 9 months, and you've got bone growing all through here.
Okay.
So this is all locked together as one solid piece.
Okay.
And that's why your back pain and leg pain are gone.
I'm excited.
Lean to your right, lean to your left. Good. Now lean back against my hand. Oh my goodness, great. Turn sideways. One more time, and lean forward and touch your toes. Okay. Now, you can say no, but would you mind if we just show what your incision looks like? You can leave your pants on and things like that. But so the incision for this is right here, and it's about this long. We always say hook 'em horns. It's the longhorn sign.
Yes.
Since we're here in Austin, Texas, and that's healed up nicely. Thank you.
Sure.
Let's see, any other questions I wanted to ask you? If you had it to do over again, you would do it or not?
Yes. Yeah. Highly recommend it.
So do you feel like you've lost motion or gained motion because you've lost the pain?
Gained motion from no longer having the pain.
One of the things that patients think is that because you've had a fusion that you won't be able to bend and move very well. And what I have found is that because of the ball and socket joint of the hip, when you actually go to bend forward, the largest percentage of that motion is occurring around the hip joint. And you can lock together one vertebral segment and even two vertebral segments. And in a woman who has normal flexibility or good flexibility, you could still do all the activities of normal living and certainly exercise and work out.
Yeah.
Well, thank you.
Sure. Thank you.
You're a magnificent sport for us, and this is a great result.
I appreciate all you've done and allowing me to have my life back.
I'm glad. That's what we're here for. Thank you.